Hey, and welcome to Medibles, where I talk about medicine, mindset, wellness, and so much more. I hope you stick around with me and learn something new today. Now let's take it to the whiteboard, where I will discuss cholecystitis, including the causes, symptoms, diagnosis, management, and treatment. Acute cholecystitis is a condition that results in inflammation of your gallbladder, most commonly due to a blockage of the cystic duct by gallstones. Let's backtrack a little bit and break down what all of this means. Typically, anytime you see a health condition having itis in the ending, it typically signifies some sort of inflammation. So in this case, it is inflammation of the gallbladder. Now, what exactly is the gallbladder? It is a small organ, resembling a pear in its shape, located in the right upper quadrant of the abdomen right beneath your liver. It is responsible for storing bile, which is released during the digestion of meals, particularly those that are high in fat. Keep this fact in mind because it will be important when I discuss the symptoms of the condition. The concentration of bile can then result in the formation of gallstones. There are two primary types of gallstones, which are cholesterol gallstones and pigmented gallstones. Cholesterol gallstones, as the name suggests, result in too much cholesterol in the bile. This is notably the most common type of gallstone that can present. Pigmented gallstones result from the accumulation of too much bilirubin within the bile, which can happen when there is increased red blood cell breakdown from certain conditions. There are a number of risk factors that are associated with acute cholecystitis. Acute cholecystitis is more common in females and makes up 60% of the patient population. The condition typically presents after the age of 40 years old. Although the formation of gallstones can start appearing earlier in life, the prevalence increases with age. Some other risk factors include having a sedentary lifestyle, being overweight or obese, eating a diet that is high in fat and low in fiber, having a family history of gallbladder disease, and having a Native American or Hispanic background. The most common symptoms that are experienced with cholecystitis include right upper quadrant pain, nausea, vomiting, and fever. If you recall, I spoke previously that bile is released during the time of digestion. After a meal, the gallbladder contracts, and if there is a blockage, this can result in pain in that region. The pain associated with cholecystitis is typically waxing and waning, which means that it comes and goes. Pain from the gallbladder can also, at times, radiate to the right shoulder blade region, which is known as referred pain. Hey, your friendly neighborhood doc, just checking in. If you feel that you may be experiencing any of the symptoms described in today's video, please speak with your doctor or a licensed mental health professional. In order to properly diagnose cholecystitis, your physician will typically perform blood work and order an abdominal ultrasound to look for gallstones and any signs of inflammation. Treatment for cholecystitis typically depends on symptom severity. I want to mention something here before I move on. Gallstones are actually quite common, and just because someone has gallstones does not mean they will get cholecystitis or even have symptoms of any kind. Some people have gallstones that are found incidentally on imaging, but no treatment is typically needed because they don't have symptoms. However, once there is the development and persistence of symptoms, this is when management and treatment of the condition will be needed. Once cholecystitis has been diagnosed, the first step is typically to give fluids along with antibiotics to treat the present active infection. Once the inflammation has settled, a cholecystectomy is typically done, a type of surgical procedure involving the removal of the gallbladder. The procedure is done laparoscopic and takes about an hour. Lastly, I want to close out by mentioning some ways to prevent gallstone formation. Since a diet high in fat and low in fiber is a risk factor for the development of gallstones, including more fiber-rich foods in your diet can be a great way to stay on track. Patients after surgery will typically be recommended to lower their fat intake. Exercising and trying to maintain a healthy body weight are two other great ways to decrease the gallstone risk. That's all from me today, but if you're enjoying this type of educational content, be sure to like and subscribe to stay tuned for much more to come. If you have suggestions on what you would like to see next, drop them down below in the comments, and I'll try to make a video on it. Here is another video I thought you might like and my latest upload in case you missed it. Until next time, bye.